Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. You're invited to join us on air, asking your questions by calling in on the local rate phone numbers in the UK and the US, which can be found on ldnradio.org. Thank you for joining us. This show was sponsored by Belmar Pharmacy. Belmar Pharmacy is a nationally respected compounding pharmacy. They compound low-dose Naltrexone, LDN, bioidentical hormones, and custom amino acids and mineral blends. They are based in Colorado and ship nationwide. Their goal is better patient outcomes through quality compounding, combining effective communication between practitioner, pharmacist, and patient. Call 1-800-525-9473 or visit belmarpharmacy.com. Today we're joined by Dr. John Kim. Thank you for joining us, John.
Well, thank you for the invitation, Linda.
For those people that haven't heard you on our Vimeo channel, would you like to tell us what it is you actually do in medicine?
I'm actually in between transition, as some people may know. But right now, I'm working in last 10 years. I've worked in Georgia Integrated Medicine, where about 50% of my practice is in pain management, and then the other 50% is solving complex medical puzzles, especially autoimmune conditions. And actually, I discovered LDN as a part of the second part of the practice. And the second part of the practice actually came about because I have wonderful techniques to help patients with chronic pain, except for the patients with autoimmune disease pain. Those pains just was harder and tougher. And what had happened is I just would look harder and had to change my paradigm and look for other tools other than what I had, and kind of open the door through LDN to treat a whole bunch of other conditions, especially autoimmune conditions, with great deal of success.
Would you like to tell us what it is you have trained in?
So the original training in medicine, it began with family medicine, and I chose that because it was most holistic of all areas, but I wanted to train more, so I actually changed my career or specialty to preventive medicine, and then from there I learned medical acupuncture, and then went on for fellowship in integrative medicine with Dr. Andrew Weil as a residential fellow, and then that kind of sums up my tradition, the training. But I've also did extensive basic science research in biochemistry and pharmacology.
What would you say the outcomes have been for the patients that you have prescribed LDN for?
You know, the LDN, for me, it hits even closer because the LDN originally was brought by one of my favorite patients. I'm not supposed to have favorite patient, but this patient is favorite because she one day said, "Hey, I have this condition called Hashimoto's thyroiditis, and the prognosis is really depressing. I get to take medication, and as Hashimoto's thyroiditis destroys more of thyroid, I get to take more and more and more, and you never get off." And she said, "I found something interesting called low-dose naltrexone, and would you please do research?" And I said, "Sure." And when I did research, that was about 10 years ago, and there was less research articles, but even then, it really looked like the risk-benefit profile, meaning that how much risk is there and how much benefit is there, and looked like the risk was very, very limited, small, and the benefits sound so incredible. And so I prescribed the medication, and what had happened is that her disease went into remission, full remission, and did not require any further use of hormone treatment. And then what had happened is that within several years, she got pregnant and retained her baby, because before she was having issues with, I think, miscarriage. Mm-hmm. And then she gave birth, and then after the birth, her disease returned, and this time it became like almost like Graves kind of picture. And we again used low-dose naltrexone very successfully and helped that illness to go into remission as well.
Did she take the LDN throughout her pregnancy?
Yes, LDN through pregnancy is a very interesting topic, and I have them talk to their doctor, but as part of the acupuncture practice, I have a small part of it is fertility, and I've noticed that LDN helps patients to get pregnant. For those, I think, that had issues with their inability to get pregnant is coming from autoimmune condition, and I think that LDN can reverse that, and I've seen LDN reverse endometriosis, and again, I think that the LDN, a lot of the illnesses that we have an autoimmune basis, or if we don't use the word autoimmune, what I like to use is dysfunctional or stunted immune system. The immune system is no longer being intelligent, and I think the LDN corrects it, and that's why I think that the LDN is such an interesting drug, because LDN seems to be what we call an adaptogen. Adaptogen in herbs means that it brings a system into balance. So if it's too much, it brings it down. If it's too little, it kicks it up. And I think that's how LDN works from everything from autoimmune diseases to HIV to cancer. And LDN, I think, is like almost a class of its own, because it does so many nifty therapeutic actions with some limited side effects.
Mm-hmm. What side effects have you noticed with your patients?
There's at least two people that I've seen that they have severe depleted state of endorphin. They've been ill for a long, long, long time, and their resilience is very, very limited. And for those people, even I've noticed that even 1 microgram of low-dose naltrexone, they have a hard time taking it. And if there was a homeopathic pharmacy, I even wondered that if they can make nanogram dosing of naltrexone for these people, but these people are few and far between. Most of other people, the side effect is, I think, more easier to handle. Like some people, instead of helping them to sleep, it has an exciting effect. So if that's the case, it's pretty simple. They just take it during dinner time, or in certain cases, I just tell them to take it with lunch or even breakfast time.
Well, we did have a question which fits in quite nicely with what you're saying, and it's from Deb, and she has her own thyroid group with LDN, and she says, have you seen a patient with genuine allergic reaction, not just a side effect, on 1.5 milligrams of LDN?
So I think that the allergic reaction, if they're talking about anaphylactic reaction, that's probably due to the filler, not necessarily to the LDN. Like I said, the two people that I have seen a reaction, even 1 microgram, those people, I think, probably the reaction that they're describing is closer to allergy. But however, I've not seen the typical, what they call anaphylactic or IgE-mediated response to naltrexone. And it's theoretically possible, but I just haven't seen it at this point.
We have a lady called Lynn from Australia who has been using LDN for 2.5 years for Graves' disease in kidney neuropathy, and all are inactive now. But she does have small, reoccurring, low-grade bladder cancer. Her naturopath suggested that she should take a test to show nutrients which would affect the cell line of cancer patients. So she's asking, would this test be worth having in regard to bladder cancer and LDN?
I think that's a wonderful question, and it's also happens to be a complex question. And the reason why I say this is that the low-dose naltrexone effect on cancer, I think that is it's beyond theoretical. I think that we're beginning to have case series of studies that would be basis of one day doing a randomized control trial using LDN to use either as a complementary to the conventional therapy or standalone agent. In terms of the nutrition testing, it is very popular, and we call those approach functional medicine within the integrative medicine sphere. And in those philosophy, testing everything that you can test on micronutrient testing, or even testing of the agents that are part of Krebs cycle, and testing those intermediate biological functional markers to be useful. And I think that, to be honest with you, I think that the research just is not yet fully there. I think that the testing of micronutrients in the United States, we call them SpectraCell, is one company that they will basically test different types of antioxidants, vitamins, and I think that it's a reasonable thing to do for cancer patients. I would not recommend it for everybody who is in good health, but for cancer patients, if you asked me 6 months ago, I would say I'm not sure, but I think that because of cancer is such a debilitating and life-threatening illness, because the conventional medicines alone not yet have a full control over cancer, because even with LDN, looking at Dr. Bihari's study, that really it wasn't 100%. I mean, he did not get 100% either. So I think that we have partial answers on cancer. That means that we have room for improvement. And I think that some types of micro nutrient testing for cancer patients makes sense. Again, I would not recommend it on a healthy person to do on everybody, but for cancer patients, because the stakes are so high, because we still do not yet know, and because of the latest protocol by Dr. Bergson, who combined alpha-lipoic acid with low-dose naltrexone to help stage 4 cancer patients to go into remission. So if you look at that, then all of a sudden, what else are we missing? I mean, are there systematic studies? No. So then, if there's no systematic studies, then you have to become study of one. And how do you do that? Just like what the naturopath is suggesting. Mm-hmm. I think that it is reasonable for cancer patients, not for just for everyone. Because mm-hmm. I think there's part of us that can be narcissistic and say, I want to test everything you can on you, genetic markers and all the nutrients. But I think that moderation, I think oftentimes is a good way to go. But for wood cancer, I think that my answer would have changed the last 1 year. The more I think about it and the more I read and the more new studies come out.
Okay, we have a question from Christina, and she says, I have postpartum thyroiditis from a pregnancy in 2011. My thyroid has never recovered and is very large with hyperthyroidism. I do not have Hashimoto's. Should I start off at a very low dose because of my thyroid issues?
So that's the wonderful thing about low-dose naltrexone. Like I think I've shared during the earlier that one of my patients the patient who introduced me to LDN in the beginning had Hashimoto's, but then she had postpartum hyperthyroidism, and LDN works for both. And some people would think, how can that be? How can LDN increase the function of the thyroid and also decrease the function of the thyroid? But if you look at it as LDN is an adaptogen for immune system, meaning LDN restores lost balance of immune system, then everything makes sense. It's like, because the low-dose naltrexone can increase the overall balance of immune system, it can help with hyperthyroidism, it can help with hypothyroidism, because the mechanism in both cases is exactly the same. Decrease the abnormalities within the immune system, and it does it by, it seems like through glial cells, binding through glial cells to the glial cells. Then there is a certain type of receptor that is responsible for releasing pro-inflammatory molecules. So by LDN binds to that site and does not allow further release of inflammatory molecules. So I think that answer would be yes. Find somebody in her area that is capable and is familiar with using LDN for those circumstances. And the other thing is that in such circumstances, I think aggressive testing makes sense. For me, if I had patients like that, I keep a very close eye on them, and I will test them even monthly to see what their labs are doing.
Well, she then goes on, she says that she's actually been on LDN 1.5 milligrams, and she had to take it every other day in the morning because she got very jittery. She said she built it up to 1.5 milligrams daily and felt better, but then after 3 or 4 weeks, her symptoms suddenly came on strong. She said, does LDN bring out the disease and make you worse before you get better? Should I increase if I start to feel worse? And how long should I expect to feel worse before I start to feel better?
And I think that it's very rare that with my patients I have seen unheard of those reactions. And I think one of the emails you sent me, I think that person had a similar reaction where that there seemed to be sudden release of catecholamines, which means molecules like epinephrine, norepinephrine get released. And in such cases, I think that really have no choice but to go slowly and utilize incremental increases. And I think when people have like a complex reaction is when I will recommend them to consider having more than the standard, just use LDN. I would say you need to use more of a shotgun approach and utilize multiple assets. And I think that seems to be a good example because she's having a complex reaction. It's not a typical reaction. And so for that, more diagnosis to see if there is any kind of issues of catecholamines being higher in her body than it should be. And there's a testing that they can do over 24 hours of urine collection. They can measure the overall amount of catecholamines in the body, and that indicates other problems that can be present. But if she wants to solve the issue, I think the best thing to do is branch out to other tools And that's where I really love having more than just one tool. So, for example, I would use LDN, I would use acupuncture because it also increases endorphins and decreases inflammation. Supplements that can also reduce inflammation, as well as immunotherapy that I talked about. And those 5 things are what I recommend people to try before going to the conventional medications. But in some cases, I see that even combining all those are not good enough. And then they have to use number 6, which is conventional medications and conventional approaches. And I think that it's just important that conventional medicine is not our enemy. It's neither our friend or an enemy. It's supposed to be our servant. But we don't want it to be a master. We don't want it to be a dictator, create all kinds of problems.
Mm-hmm. Okay. Well, we'll get ready and go into a break. If anybody out there would like to phone in and ask your questions to Dr. John Kim, if you want the numbers, just go to www.ldnradio.org. We'll be back in a minute. The LDN Health Tracker app, called My LDN, is available free for Androids, iPhones, Macs, PCs, iPads and notebooks. The app allows you to keep track of all your medications, pain levels, sleep, quality of life, etc. You can print out graphs and charts to take to your doctor. Full details on the LDN Research Trust website. You can keep a journal so you won't ever forget anything again, and set alarms. The app is free and all your information is held securely and anonymously. By using the app, you'll be taking part in the world's largest LDN survey, anonymously. Any questions, please email me, linda@ldnrt.org. Belmar Pharmacy is a nationally respected compounding pharmacy. They compound low-dose Naltrexone, LDN, bioidentical hormones, and custom amino acids and mineral blends. They are based in Colorado and ship nationwide. Their goal is better patient outcomes through quality compounding, combining effective communication between practitioner, pharmacist and patient. Call 1-800-525-9473 or visit belmarpharmacy.com. Now we will take a call. Hello, can you hear us?
I can hear you, yes.
Fantastic.
Can you hear me?
I can indeed.
Yeah.
We're getting there somehow.
Wonderful.
Great. Well, I was a guy, Dr. John, who said that I'd had a cancer diagnosis 3 years ago, bowel cancer. I haven't been using naltrexone yet, and I've had some chemotherapy, but on both occasions I had capecitabine to start with, and then I had fluorouracil, and both of them threw me into A&E. So I've gone off the idea completely of conventional, what's it called, chemotherapy. And I'm just looking for alternatives. We've changed our diet, we've done all sorts of things, and feeling very positive, but just want to find out from you whether you think that I can be helped by LDN.
May I ask you what stage of cancer you were diagnosed with?
Oh, I think it was a 1.
So then you are cancer-free at this time?
No, I had a CT scan a couple of weeks ago in November, and that showed that the tumours that they found that showed up in April have actually got bigger on my liver and in my right lung. I did have an operation to remove tumours from my left lung, so I had the left upper lung removed, and also I had about 30% of the liver removed.
So when a cancer that starts in one area, let's say colon, goes to different areas such as liver and lung, considered metastatic or stage 4 cancer. So the use of low-dose naltrexone for cancer in that I've read about and that inspired me to use it actually are twofolds. One is the original physician who made it popular or known to use LDN. Dr. Bihari used low-dose naltrexone for treating cancer very successfully, and he had documented it. Now, there's a second physician, Dr. Bergson, who in New Mexico, who is utilizing low-dose naltrexone and alpha-lipoic acid, and in his case, he does injections very successfully. So those are, and both parties have written. Dr. Bergson has published. So right now, all of my patients that have cancer who come to me, pretty much, I recommend them a protocol of low-dose naltrexone as well as alpha-lipoic acid, as well as other supplementation. Now, as to stage 4 cancer, fighting it just using low-dose naltrexone, generally, I don't recommend it. I recommend using all the tools that you have because of the graveness of the diagnosis. Using all the tools is what I recommend. Now, having said that, Dr. Bergson does have documented patients who have used low-dose naltrexone, alpha-lipoic acid, and his other protocols that he utilizes. And my recommendation is find someone near you who has utilized that protocol to success. And
I think there's a Professor Dalglish who's in the UK, and he's been fairly active, I think, in the LDN and cancer field. Have you come across him?
I think that there's also Professor Liu, whom Linda has connected me with.
Right.
And you are part of the LDN Research Trust in Facebook, right?
No, I don't do Facebook.
I would like to highly recommend you to join, and it's a really wonderful community to ask other people, especially in your circumstances, to do it. But in general, I recommend for patients for fighting cancer, for integrative medicine, low-dose naltrexone, to use all the tools that make sense to them, and all the tools in their disposal. Because really, my experience at least has been that with stage 4 cancer, that it's really difficult to make peace with stage 4 cancer. The cancer wants to grow continuously, and there is no 99%. It has to be 100%, because if you leave it even 1% is alive, it will double, redouble, and at a certain point, our body, we call that tumor burden, and after the tumor has grown to a certain size, it just puts a tremendous amount of burden in our body.
Yep. Now, what about using hemp oil as well? Anything about that with LDN? Would they conflict or not?
No, I don't think so. Professor Liu, actually, his original research is in using medical marijuana and cancer. And I think that, and the interesting thing is that you mentioned hemp oil.
Yeah.
The hemp oil, yes, but for my patients, I recommend what we call Rick Simpson oil in the U.S., and that is actually a full complement of THC and CBD combined. And
could you just say that whatever it is again, please?
It's called Rick Simpson oil, and basically it contains both CBD and THC. It contains both portions, and I just think that has better promise than CBD or hemp oil alone, because in the U.S., there is a breed of hemp oil that is very rich in CBD that has been developed by Stanley Brothers, and it's known as Charlotte's Web, and it can be purchased in the U.S. legally in all 50 states.
Right.
The issue is that, and in the state of Georgia in the United States, I have been one of the physicians allowed to utilize medical marijuana as to treat cancer or help patients with cancer. And my observation has been that CBD oil alone or hemp oil alone does not bring about consistent effect. So for seizures, absolutely, very consistent effect. For LDN and cancer, I think that there is medical marijuana, I think that there's a synergistic effect of all three, because the part of the pathway endorphins strengthen, or the LDN strengthens the endorphin system, but I think it also strengthens the cannabinoid system and makes the cannabinoids work better. So patients that I recommended to take medical marijuana, all of them, I've also recommended LDN. All the LDN patients, I also recommend them either hemp oil or Rick Simpson oil.
The next caller now. If not, we won't have chance to get through the queue.
Yeah, sure.
Okay, thank you. Thank you for your call.
Thank you very much, Dr. John.
Yes, sir.
Okay, I think we have another question here. That may be cancer. Hello? Hello, are you there?
Hello, are you talking to me?
Yes, I am.
Okay, this is Phyllis. No, this one wasn't cancer related, but I can probably find one if you want.
No, that's
This
fine.
was about mast cell activation disorder, and if Dr. Kim has ever prescribed or treated anyone with that condition. Has he prescribed LDN?
So I think that, I have not seen one described as such, but I've seen many patients who have the symptoms of. And I think the mast cell activation disorder is closer to what the physicians call like an IgE-mediated allergic reaction. The mast cells release histamine. Some of the interesting things about that is the speed at which it can occur. It's very rapid. Some people, you just have to scratch their skin and you can see a welt developing very, very quickly. Is your symptom like that, or is it slow?
This is a question from a group member, not me personally. I'm just...
So the answer is that, yes, I have utilized LDN, but the utilization of LDN in such cases, I think that, and it's an excellent question. The LDN, I think, is a wonder drug for autoimmune diseases, but I don't think LDN in many cases should be utilized alone. Like the previous caller wanted to just use LDN for stage 4 cancer. I think that of course, it can be done if he can find a physician willing to do it, but I think that the better approach in this case, and I've had patients with similar symptoms, is that LDN combines wonderfully with another immunotherapy, which is more common in Europe. It is called allergy drops. And what you do is you test person for the offending agents from environment as well as food, and mostly it's IgE with food. IgG can be also included. And the wonderful thing about it is once you are armed with information, what things can trigger them, you can utilize allergy drops and LDN together to allow them to the immune system to be re-educated. So I'll give you an example. One patient that came to me with mast cell activation, and hers would begin with eating fruit. Whatever kind of fruit, she would just not be able to breathe. And she loved fruits. So for 10 years, she couldn't eat fruits. And so I put her in LDN, and it made her symptoms a little bit better. But in a year of allergy drops plus LDN, she was able to eat fruits again, and she had no reaction. So in that case, can you get that reaction just by using allergy drops? I think it's possible, but usually allergy drops, it takes 5 years. Whereas in this case, within less than a year, with LDN and allergy drop, we're able to get that rapid reaction. So I think that LDN is a wonderful tool. Anytime the immune system is not behaving the way it's supposed to be, it's hyperactive or it's sluggish, I think LDN is a wonderful tool. But I think there is this idea and temptation almost to view LDN as a single agent for everything. And I think that everything has a tool, and some of the patients that having severe symptoms, I'm not afraid to use LDN, Montelukast, which is also sold under the name of Singulair, which is a prescription medication, or some of them I ask them to take Zyrtec, and then the allergy drops. And the wonderful things about LDN is that it seems to re-educate the immune system. So it's almost like an intelligent approach, and it complements the allergy drop because that also is an intelligent approach.
Understood. I guess this question probably has the same answer. It was just to ask in a different way if LDN can work to help histamine inflammation. So would that basically be the same answer?
Well, I think the answer is I think that I would be more careful to use histamine because what they're talking about, I think, is that what happens after the mast cells have released histamine. So in this case, what you're looking for is rapid response. Can LDN be used to stop an anaphylactic reaction? I don't think anyone has done the study, but I don't recommend that clinically. If someone is having an acute reaction, I think the proper response would be either Benadryl shot or Benadryl liquid or Benadryl.
They use the word inflammation. I don't know if that's different from a reaction.
Well, the histamine inflammation is very rapid, and I would say that if you're in that rapid phase of inflammation, and the answer I think is similar when you're having rapid phase reaction of inflammation. I think that you have to use all the tools that is required, including steroids, including in case of histamine reaction, antihistamine, and then use LDN long term to gain control and basically create another equation, change the equation, because LDN can change the basic equation, but at the time the house is burning down, you want to use everything. But LDN is a wonderful tool to redesign that infrastructure so that inflammates the immune system just only has one response: inflammation. So LDN can change that. And it's very interesting because people who have overreaction of those situations, oftentimes their immune system is actually depleted. So that means they get sick easier. I tell them that's very similar to, police being called by naughty teenagers 24/7. They can't do their job. Whereas the well-rested police force can respond to 911 emergency calls quite adequately.
Okay.
Thank you.
Yes, thank you. We'll just go into another break. Hopefully I'll get it right. And we'll be back with you soon. If anybody wants to call in with more questions, we'll be happy to try and answer them. The LDN Research Trust has an LDN Vimeo channel. I have interviewed over 550 LDN prescribers, researchers, pharmacists and patients from around the world for many conditions. You can find the link on the LDN Research Trust website. If you'd like to be interviewed sharing your experience, please email me, linda@ldnrt.org. I look forward to hearing from you. Belmar Pharmacy is a nationally respected compounding pharmacy. They compound low-dose Naltrexone, LDN, bioidentical hormones, and custom amino acids and mineral blends. They are based in Colorado and ship nationwide. Their goal is better patient outcomes through quality compounding, combining effective communication between practitioner, pharmacist and patient. Call 1-800-525 9473 or visit belmarpharmacy.com. Okay, we're back, and what I would like you to do now, John, is could you answer some of the emails that were sent in, please?
Absolutely. I want to. I really love the question that your readers or your Facebook members are just so intelligent and wonderful. One of the questions that I saw is that a patient who was diagnosed with pancreatic cancer, and she's taking tramadol for pain, and the clinic basically is agreeable to put her on LDN. Her or him. But the thing is that they want the person off tramadol, and the person is asking, what do you do? So I think it's a really lovely question because I've seen this sort of question regarding tramadol. So it's tramadol or Ultram, which is a brand name, is basically a form of synthetic opioid that's not full-on opioid. What I mean by that is that it's got two different actions. Number one is that it does bind to the mu opioid receptor, but it also works as a serotonin and norepinephrine reuptake inhibitor. And I think that it seems to me that this has multiple answers. So the first part of the answer is that if the clinic says no, you can't take LDN and tramadol together, I would say that the person can explore an herb is very, very effective, known as Coriodalis. Coriodalis does not use opioid receptor, but has high efficacy, effectiveness for controlling pain, and that is my to-go herb to control pain. The secondary herb can be something like curcumin, and especially if they can find a long-acting curcumin, it can be helpful for controlling pain. Another tool that I find exceptionally well-suited that works in conjunction with low-dose naltrexone is what I call neuroanatomical approach to acupuncture, and that is a new way of using acupuncture using scientific principles, and it works on strengthening the endorphin system and reorganizing the neurological signals that our pain produces. The underlying question to this is, can you combine narcotics and LDN? And I think the answer is yes. And I formulate this from research done using what we call the microdose dosing of LDN. So instead of using the normal dose, LDN uses 1.5 milligrams to 4.5 milligrams. But in microdosing, you use microgram doses. That would be 1,000 times less than 1 milligram would be 1 microgram. And that even in my clinical use, when people are using narcotic agents, my to-go game is to utilize microgram dosing of naltrexone, and it seems to actually help patients to get pain relief longer. And then what I do is you can increase the dose of microgram dosing of LDN to push it up. And then what happens is similar to them not taking the medication. You're just doing backwards. By increasing the inhibitor strength, you're basically taking down the amount of narcotic that is effectively available. And just two different approaches, but I think that it's more humane. And I'm not convinced, because the effective dose for the naltrexone to overcome narcotics is about 50 to 100 milligrams anyway. I don't think adding 1.5 milligrams or 5 milligrams will make a difference in majority of people. Now, I have to say that because I know that in literature there are people who are exquisitely sensitive that even utilization of anesthetic during surgery didn't work. They had to use massive amounts, and then at the end the anesthesiologist said, "What on earth is going on with you? Why is it that I had to use massive doses of narcotics. And says, oh yeah, I'm taking LDN. And so in that case, those people, the LDN is working so well, or probably what is happening to those people is that their affinity, the LDN attraction to the receptor is exceptionally stronger than the general population. But in general, I think that LDN, using LDN and especially microdose naltrexone or very low dose naltrexone is safe with utilizing narcotics. So I think that was a wonderful question.
Do you have time to answer another one?
Yes, there was another question of RSD or the CR, complex regional pain syndrome, and that is a really heartbreaking condition. Worst condition you can see. It says my neurologist started me on 3 milligrams, 4 milligrams, and 4.5 milligrams. I had some pain relief, and now for 6 weeks, but the burning pain returned back to the same level. Is there a reason? Is this a typical reaction? Do you agree with my doctor's opinion that I would get more benefits after 5 months? I think that it's kind of interesting because 1.5 milligram to 4.5 is like the standard, and that's written in stone. But if you really dig in and do the research, there's no dose response studies that was performed on low-dose naltrexone. It was sort of a convention developed over time and accepted by researchers. But I think that there's multiple ways low-dose naltrexone works, and one way, of course, is that it works through the immune system, and I think that the dosing of that 1.5 to 4.5 often works quite well. However, there's another way that LDN, especially for CRPS and neuropathies, that LDN can be helpful, is that LDN also works as an anti-inflammatory agent for central nervous system. What that means is that in that setting, the dosing of LDN is going to be more dose response curve, what I call linear response. What that means that depending on who you are, you will need more than 4.5. I have patients who need 6 milligrams and who do very well on 6 milligrams or even 7.5 milligrams. And obviously I don't start patient on there, I titrate them. And if you look at the original dose of medicine being about 50 milligrams, I think even 9 milligrams is not unreasonable for a minority of people. But I think that rather than waiting 5 months, what I would do is push the dose to 5 milligrams and then 6 milligrams to see, and 7 milligrams to see if that's helpful. The other part is that CRPS is a nervous system disorder, so alpha-lipoic acid would be another tool that can be very, very helpful, and taking very high dose of fish oil also can be helpful. But be forewarned that taking high dose of fish oil can result in bleeding episodes or easy bruising episodes. So it would be better if you are under care of a physician or a naturopath who is familiar with that. And alpha-lipoic acid, you also have to be aware that it can lower your blood sugar levels. So that's another thing you have to watch out for.
Mm-hmm. And as we were talking about before, how important is diet?
I think that this very romantic idea that you take LDN and it's like a magic bullet. It works for everything. I think the diet is important because the way that LDN, and that's why, in my own practice, I do, when I intake patients with autoimmune diseases, in the beginning I just said, eat well, and patients would not listen. A minority would do, most wouldn't. So now I just do the full test of food allergy testing, because that way I can see and show them and then plead them to not eat these groups of food. And second, we need to do allergy drops to normalize your response to that food, because obviously it's not killing off our population, but I also would say that there's something that has changed, that our people are having autoimmune diseases. It's like an epidemic. This is just everywhere. Everyone's having autoimmune condition. Why is that? And I think it has to do with we're doing something differently. Has our genetics changed in 50 years? I don't think so. what has changed? Our diet has changed, and our pollutant exposure has changed. So I think that we will find more that a lot of the plastic exposures that we're having we will find to be harmful for our immune system. I think the research is just beginning on that. But diet, I think, is important. Why? Because everything that happens in our body biochemically is all predicated by what we eat, what we put in our body. Our body then, if we eat anti-inflammatory food material, then our body will become anti-inflammatory. If we eat pro-inflammatory food groups, then the end result is that we will be suffering from the high levels of inflammation in the body. So I think that LDN is a wonderful tool. However, it does not give you permission to eat badly every day, smoke, and pursue unhealthy lifestyle.
We've just had a question come in, and it says, could you define allergy drops?
So allergy drop is basically, I think that everyone has heard of allergy shots. When you have severe allergy, you give shots to people, and it does work, but I just don't like giving shots. My family members hate shots. My patients hate shots. So what I've done is look for a solution that doesn't involve shooting allergies. It always made sense to me that if it works by parentally, meaning giving shots, it would make sense using the GI system, because a big portion of our immune system is in our gut anyway. So I've been looking for a solution, and about looking into this problem for about 5 years, I found a solution. There's a company, and I'm told that this is a more common approach in Europe, to use allergy drops. And allergy drop means that whatever you're allergic to, food or environment, you can create an antigen to the dose amount of that corresponds to how much you're allergic to. So if you're allergic to huge levels, then you give them minute amount of allergen, and then you systematically teach the immune system by exposure to not to overreact. So you can do that to peanuts, you can do that to wheat, you can do that to the milk, you can do that for grass, fungus. The big thing that I see is yeast. So that's the allergy drops that I talk about. And I think that like I said, the LDN and immunotherapy go hand in hand, in my opinion, for autoimmune. And the reason is very simple. Both of them are intelligent approach to re-educating the immune system. And it seems like immune system is amazing, because that one patient I talked about, that she was allergic to fruit, what I found out is she was allergic to grass. And grass, of course, is cousin of fruit. So I treated grass allergy for about a year, and lo and behold, she was able to eat fruits again. And I never went to even specific foods. I just treated grass, because that was the one thing that she was most allergic to. So it shows how intelligent immune system is. Of course, she was also taking LDN at the same time, which I think shortened the duration needed for her to go into remission.
Well, I'd actually like to now talk about your LDN book that you've just managed to get published, and it's available on Amazon. Could you tell us more about your book?
Yes. You know what? It kind of began as my note, because I in the beginning, LDN was like magic. It would work, and I was almost thinking, why does it work? Why does it work? So I started just reading, and first it was blogs, your websites, and then I just dug deeper because of my research background. I just went to the research databases, and I would just read different studies done and understand better how low-dose naltrexone would work. And, of course, there are books already available, including recently published by, I think you were the editor in one of those books. But I wanted to go to the source and learn more. And so this book is called LDN Primer, and I call it Primer because I feel like even after 15 years of using low-dose naltrexone, I feel still I'm a beginner. And in here I just talk about the history of LDN and the LDN as a novel anti-inflammatory agent for central nervous system, which I don't think is very utilized very often outside my clinic, and then LDN for treating endorphin deficiency syndrome. Again, I'm looking at the conditions that LDN can treat as groups. So if you have an inflammatory condition for central nervous system, LDN can be useful. Even though it's not an autoimmune condition, the LDN can be useful for people who have endorphin deficiency. And who knows, if the bipolar disorder, depression, anxiety are a subset of endorphin deficiency syndrome. And I certainly treat it that way, and I have utilized LDN alongside with SSRI with great effect in even bipolar disorder with great effect. And then the other thing is LDN as immunoadaptogen. And then number 5, I talk about atypical uses of LDN, like what I talked about. And then the last chapter, I talk about clinical considerations of using LDN. And all there, I've shared stories of my patients and my observations and ideas that I had, like dosing. How is the dosing determined? It's not scientific. It's been just supposition, just guessing. So that means we have the right to ask. And what's really wonderful about your Facebook group is the interactiveness. And I see what they mean, because some of the people start 0.5 and they think that's too much. I had to cut to 0.1 because, like in my practice, that's what I do. I look at a person and try to determine how much endorphin reserve do they have in their life. If someone has high functionality, then I don't mind starting off 1.5 and then rapidly going up to 4.5. But if I get the sense that they're very depleted, I would start from 0.1 and then march slowly to get them to 4.5, but take my time doing it and looking for any side effects. So it's been, it's a result of me wanting to understand LDN better, and started a blog and just continued writing. And I just kind of got caught in the web of interestingness of LDN, and I just couldn't stop writing and stop researching. And even preparing for this show, I found out there are more studies out now, and it's just really a fascinating subject.
I know a lot of people will want to know, how do they know how high to go if 4.5 isn't the ceiling? How do they know that the dose is right for them?
Yeah. So I think that, again, understanding how LDN works is crucial. So I call it 2 different dosing. One dosing is linear dosing. The other dosing is synergy dosing. So what do I mean by that? The synergy dosing, I'm referring to the LDN educating the immune system to calm down. So for most autoimmune diseases, I utilize LDN. The lowest amount of LDN required to put patient in remission or their symptom into 0. So in those cases, some patients are taking 0.5 if they're in remission. I don't want to increase it, because if their disease comes back, then I want to have a little bit of room left over to increase the dosing. But if there are other people who have central nervous system issues, so I'll give you an example of what I mean by this. Neuropathy would be a great, peripheral neuropathy, diabetic neuropathy would be a great example. Another example would be post-herpetic neuralgia, and that LDN can do amazing things. But in those settings, we're not really counting on the LDN to reset the immune system. We're using LDN as a conventional medication, as an agent to create anti-inflammatory effect in the central nervous system. And for that, I think that the 1.5 to 4.5 dosing is a bit limited. And you have to look for ways to either make LDN work harder and synergy, bring out the LDN synergy. And my to-go tool for that is acupuncture, especially neuroanatomical approach to acupuncture seems to go very well with LDN. Another tool that I use routinely is alpha-lipoic acid, seems to, because it also can enter the central nervous system quite with ease and works very well in synergy with LDN.
And I'm going to have to stop you there, John. We'll have to have you back on another show, and we really appreciate you being here with us today. Thank you.
Thank you.
Belmar Pharmacy is a nationally respected compounding pharmacy. They compound low-dose Naltrexone, LDN, bioidentical hormones, and custom amino acids and mineral blends. They are based in Colorado and ship nationwide. Their goal is better patient outcomes through quality compounding, combining effective communication between practitioner, pharmacist and patient. Call 1-800-525-9473 or visit belmarpharmacy.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.